Hello, my name is Uri Kartoun, and I'm from IBM Research in the Cambridge, Massachusetts lab. I'm honored to have the opportunity to present a poster at the AMIA Summit in March 2024 here in Boston. Basically, the poster summarizes a new method that we came up with, a new method and experiments. It's a collaboration between multiple institutions, as you can see here. And so basically, when a drug company develops a new type of drug, of course, the intention is that the drug is going to be efficient and basically tries to minimize the different effects and basically try to, I would say, solve a disease, but at least try to address different aspects of the disease. However, it could be that certain medications might be beneficial if taken for a certain amount of time, like a couple of weeks, a couple of months. There might be a certain point in time in which the medication might not be efficient. Not only that, it might not only not be efficient, but it might be harmful for the patient. And we came up with a method that attempts to identify this time threshold given a certain database. So it's a data-driven method and an algorithm that is based on causality and a drug that is specified in advance. It basically calculates the threshold to be inefficient or even harmful. We focused here on inflammatory bowel disease. It's an umbrella for different conditions affecting the digestive system. According to the UK guidelines focused on IBD, the thresholds for steroids is 12 weeks. So of course, it's based on mostly on experience and publications and opinion, 12 weeks. And this figure is coming from the official guidelines. The method is focused on the same disease and on steroids. It basically incorporates a database and then basically tries different types of thresholds given a certain prediction modeling scenario. In this case, we focused on a subsequent major gastro surgery, and we try to calculate the threshold for steroid to show how efficient it is given different thresholds: 1 week, 2 weeks, 2 weeks, 12 weeks, and so on. So the method basically incorporates a database and then tries different thresholds. Each time it applies a inverse probability weighting. It's a causality method, and then it calculates the odds ratio. If it's above 1, then it's harmful. It's below 1, it's beneficial. So the method iterates and runs different thresholds. Each time it measures the odds ratio, and once it's becoming a little bit above 1 or a little bit below 1, then the method stops and declares we identified the optimal threshold. We ran experiments using the UK Biobank. It's 500,000 patients, and I'm not getting into detail given the amount of time given to me, but we got focused on a subgroup of patients, 363 UC or CD patients. We developed a prediction model that we iterated through it using the method that I just described. We provide an example for using different thresholds, each time applying the inverse probability method, the causality method, and evaluating the odds ratio value and when to stop. Here I'm showing basically an optimal threshold. When the odds ratio became at around 1, they started at around 3. And the results demonstrates a couple of iterations, in this time 4 iterations, in which we evaluate different thresholds, 12 weeks or more, 9 to 12 weeks, and so on. And we identified that the threshold, the optimal threshold is below the guidelines. The guidelines specify 12 weeks, and we found that it's around 8 weeks or a little bit below. So the conclusion is that we developed a data-driven method that is based on causality, inverse probability method, and we demonstrated by using experiments in a big database, the UK Biobank, that our method is able to calculate an optimal threshold. So the hope is the method will extensively being used to evaluate different drugs, different diseases, and basically allow decision makers to make better decisions for their patients. Thank you very much.